Thank you very much. Thank you for the kind invitation. It's a great pleasure to be here with you today, and I'm pleased to see so many people still in the room after lunch. What can Asia do? And maybe let's start with a question: why are we here? What are we trying to achieve? And I would suggest you a small exercise. So you take your wrist, you put your fingers on the thumb side. Okay, do it. If you have a medical background, it's easy. If you're someone else. Can you feel your heart beating? Okay, if you are lucky enough to live 80 years old, your heart will beat 3 billion times. 3 billion times. And what we are asking is that every heart in this world has a chance to beat 3 billion times. That's a very simple message. So, what can Asia do? Maybe let me just start by introducing World Heart Federation. We are a federation of national regional societies, 240 members in 114 countries. We are historically the merge of scientific societies, typically like the Thailand Cardiac Society, the president was speaking here yesterday, and foundation and patient groups, and I'm very pleased to see in the room Global Heart Hub, Hearts for Hearts, for instance, as a members, and maybe that's your opportunity to say that for the first time, the WHF board has elected a patient representative, and Tanya Hall will be representing patient group for the next 2 years. So congratulations, Tanya. Our vision is cardiovascular health for everyone, and I mean everyone. It's not low and middle income countries. It's everyone in every country where there's a need for cardiovascular health and equity. We don't produce science or members like American College, AHA, ESC produce science, but we translate science into policy. And one of the important features is that we have an official relationship with the World Health Organization, which means we can attend the meeting, the World Health Assembly in May, the regional meetings, we can propose statements, we can get involved in consultation, and that's one of our important responsibility. In our strategy 24-26, something which was new, but so important, I think so much aligned with what we heard today, is that in terms of impact, we want to advocate for and support the implementation of national CVD action plan based on universal health coverage, adapted to each country. And that's really where we want to focus our efforts for the next 2 years and 3 years. And with 2 strategic goals, one which is at the global level, what we do with WHO, with the NCD Alliance, with the World Bank, maybe with regions like here. And the other aspect is helping our members, empowering our members to advocate at the national level. Maybe just a short reminder when we talk about advocacy, what means advocacy? And that's the definition from WHO that I like very much. So it's a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal or program. So to give you an example of what WHF does in terms of advocacy, one of our flagship program, it's called Roadmaps and Roundtables. I mean, the idea is basically you take the medical guidelines, we know what to do, we know what best practice, why is it not implemented at the country level? And in the document, we identify what are the roadblocks and what could be some of the potential solutions. So it's really focusing on policy and system health strengthening. But the idea is take this global document, and the next stage is at the country level to organize a roundtable to discuss locally what is feasible and acceptable. So you start by understanding the local situation. I think the document that APAC has produced, I think the 6 country analyses are a perfect example of this kind of analysis. And then we bring together the cardiologists, nurses, primary care physicians, academic researchers, government, Ministry of Health, policymakers, insurance, payers, industry, and all together, and patients and patient groups and advocates. All together in a one-day meeting, usually we identify what are the roadblocks in the country which are relevant, and try to identify 2 or 3 solutions which are implementable and actionable. And we have some very interesting results in different countries. You see here on the map the countries where organized roundtable for the roadmap on cholesterol. We have about 10 roadmaps depending on the topics. But it's a way at the country level to start a dialogue and advocate for a specific goal. So what are UN high-level meetings this 2025? So it's the idea is to bring together head of states for global issues. It could be president, prime ministers, minister of finances, work, health. These meetings are taking place every year. For instance, this year, a few weeks ago, you had one on antimicrobial resistance, you had one on sea level rise, and one on nuclear weapons. So it's very different topics, but the idea is to bring these issues together. So typically in health, the idea is to move from a technical discussion which takes place at WHO to a political commitment. And because the audience is different, the audience is broader, that's the right place to do it. So typically raising awareness on NCDs is one of the goals, and to mobilize international commitment because you have all the policymakers in different sectors present. So just a short reminder, in 2011, that was the first UN high level on NCDs. There was a lot of hope. 2018, there were follow-up meetings which were a bit disappointing in terms of commitment, in terms of financing, in terms of resources mobilizations. And the next one will be in 2025. So why is this meeting important? One of the first reasons is that it's the first meeting after COVID. And as we know, COVID has changed the way people have been looking at health, at resource mobilizations, but it's always shown that people who suffered from COVID, to a large extent, were suffering from pre-existing chronic conditions, heart failure, hypertension, diabetes. And that's create a link between these different things. The second point is that despite all these meetings, we still have 20 million people dying every year from cardiovascular disease. We want to set up an ambitious political goal, and more important, we want the declaration to focus on implementation and financing. We want commitment from the governments. So I'm going to review a couple of milestones which will lead to this event. Of course, it's not in September 25 that everything will be decided. You have a lot of preparatory work to be done. And just to give you a few dates, for instance, in May in Geneva, there was the first World Health Assembly. There were already a couple of discussions in NCDs. WHF could propose some statements. We had the World Health Summit in Geneva in May. If you never had a chance to attend the World Health Summit, please do it. It's the weekend just before the World Health Assembly. It gathered about 300 people, mostly members from World Health Federation, but also external people. And because it's the weekend before the Health Assembly, we get Minister of Health. Last year we had 8 Ministers of Health attending the summit, people from WHO, from World Economic Forum, and the bank, etc. Next important meeting was in June in Washington, D.C., a meeting organized jointly by the World Bank and WHO on sustainable financing for NCDs, and I had a chance to attend it. Basically, the key message were, and I think it was probably discussed from what I heard yesterday to a large extent. First, we need to mobilize local resources. There's no way a global fund will pay for NCDs. Countries have to take responsibility and ownership. Innovative financing systems do not seem to be very successful. So 2 ways. One is taxation of unhealthy commodity, these excise taxes, which are proven to be very successful. And I remind you that it's a win-win-win. First, it reduces individual consumption of a product. 2, it improves public health in the long term. And 3, it creates resources for the government. And if these resources are earmarked to health, then you can create resources for the universal health coverage and these kind of programs. Development of insurance schemes is also a way to explore whether it's private, public. Many countries have started to have a modest program to start with, but can lead to very ambitious results. The integration in primary care setting, there was a lot of emphasis on the fact that if you want to, I think it was mentioned yesterday, if you want to reduce cost, one way is to integrate better with the primary care system and make sure you don't create silos for the different diseases. AI and digital health was also mentioned. We believe at the World Health Federation that cardiovascular health could be a leading field in AI. Just because of these watches, there's not so many disease area when you can measure so many parameters just with a simple and cheap device. So we think that we can play a role in this. And there were a couple of examples. The Philippines and I think Malaysia were shown to be really successful in achieving these goals. To follow up in 24, there is in August and September, there was all the WHO regional meetings, 6 regions. WHF was represented at the Southeast Asia and the Western Pacific meetings, again, making statements and discussing with the different member states. In September, there was the UN General Assembly in New York, where we had side events, and I put the APAC summit in October. I think that's one of the events which contribute to going towards this objective. Something also important, World Heart Day. So WHF organizes every year on the 29th of September, the World Heart Day. And thank you to all of you who enjoy, contribute, and participate to this event. This year, the topic was Use Heart for Action. And there was a clear message aligned with the strategy that we wanted every country to have a national plan for CVD. There is a petition to be signed, a first petition for global health, where we ask all politicians, policymakers, to put heart health as a priority in their country. To give you one example, that's at the European Union. You might know or not know, but the European Union has no cardiovascular plan. There's a cancer plan. Some countries, Spain and others, have a cardiovascular plan, but the European Union is just nothing. And so one of the goal of a coalition called EACH, European Alliance for Cardiovascular Health, and the Global Heart Hub is one of the member of the alliance with European Society of Cardiology, European Heart Network, is to ensure that the European Union goes to this. So there was a series of meetings with member of parliaments, petitions, and something quite interesting was public awareness in the metro in Brussels. So they used the World Heart Day logo and theme and material to advertise in the subway, actually in the stations near the parliament. But you see the power of this kind of communication tools in advocating for cardiovascular health. Keeping on with the agenda, so 2025, in January, the WHO will have its executive board, where they will start putting things together. The NCD Alliance is organizing a forum in Kigali in February, the World Heart Summit and the Health Assembly in May. That's probably where WHO will come with some concrete proposals. And then in May and June, something very important, the UN usually will organize some multi-stakeholder hearings. So civil society usually are invited to one of these meetings, industry to others. And that's really where you can make your point. Okay, so if you have a chance to attend this meeting, it's important to be there and raise the voice for cardiovascular health. And in June, September, there will be some final negotiation within the UN, so it moved from WHO to the UN, and in September, the document should be approved. So that is the process which will lead to this. Now, what could WHF do for our members to help them to discuss at the national level these different items? And we're producing a briefing document. I'm just going to show you the content is going to be released early in November. But basically, we have identified 4 key areas, 4 priorities for cardiovascular health, and 4 things that we'd like to have in the document. So the document is supposed to be brief, to be accessible to politicians, understandable by a broader audience, based on evidence, data, but at the same time have a story which speaks to everyone and which representative of the global cardiovascular community. We want to be inclusive in our document. So that's don't be afraid by the figure, but it basically shows 4 key asks, and that's it shows that you need to start with major themes, and then at the end you need some granularity to really be precise in your requests. So the first one is the first commitment is a bold political declaration on NCDs. That's really the primary things. We want political declaration that renew the commitment from 2011, 14, and 18, but with a strong emphasis on implementation. Again, 40 million people die every year from NCDs, 50% are CVDs. something has to be done on this. The second commitment is on a cardiovascular health plan in every country. That's our main request. We know that cardiovascular disease are to a large extent preventable. Most of the drugs are available as generics, not to mention the new developments which improve, but we know we can treat a lot. Things like polypill can be solutions that could be implemented. So we know what to do, we know how to do it, let's do it. The third one is about a robust implementation included in universal health coverage, and that's the enabler are first the sustainable financing. I mentioned this earlier. Strengthening workforce was discussed also here. It's not only about cardiologists, it's about primary care nurses, community health workers, all the issues about migration of workforces from developing countries to high-income countries. Strengthening primary care, cross-sector collaboration, something always important, evaluation, monitoring, and accountability of the governments for success. And the last point is about CV health and care. So CV health promotion actions, risk factors, climate and air pollution, and as I mentioned yesterday, it's not only about educating people and behavior change, it's also about providing a framework where people can have a healthy life. It's nice to say don't drive because it pollutes, but if there's no way you can take a bicycle or public transport, the government doesn't help you. CV care and actions, so access to early diagnostic and management of the disease, and finally involving patients and civil society in policy and decision making. So it's basically our 4 asks, something we'd like to push, and we encourage all of you to use this document and push in the same direction so that we are aligned. Take into account, of course, the national sensitivities and the context. These the principles that underpin these 4 asks, and I think they were all covered in this meeting, so I'll just go briefly through it, but starting from the left, that's about equity between countries and within countries. In a country like mine, Switzerland, which is one of the richest of the world, you still have inequities between different parts of the populations. The focus on implementation, where it's most needed, the continuum of care, we discuss this as well, the life course, partnerships and cross-sector collaboration. WHF, we have created what they call the Circuitry Alliance, which is diabetes, kidney, cardiovascular, workforces, nurses, etc. So the idea is let's bring the topics together because we know that if you have diabetes, you're likely to suffer from cardiovascular disease and all these correlations. And finally, engaging patients and communities in decision making. So the document will be released early in November. I mean, I'm happy to share the link with all of you later on. So a briefing document is important, of course, but it's what's more important is what you and we do with it. So coming back to the question, what can Asia do? Your region, I think this meeting is already a fantastic demonstration of the commitment, of the willingness to improve situation in Asia Pacific. Your country, as we discussed here and as mentioned, a cardiovascular health plan is essential. We need to advocate for this, not only with the Minister of Health, because Minister of Health, they usually know about what we're talking about, but with Minister of Finances, Minister of Transport, Education, Agriculture, Environment. There are many stakeholders that can help to raise your point. Your city, it's something I think everybody is getting more and more interested by what you can do at the city level. And I think in Asia, you have big cities which are great target in terms of consistency of the population and the infrastructure. We've been working with the Novartis Foundation on Cardio for Cities, which is an initiative to try to bring at the city level basics in terms of diagnostic and management for hypertension and dyslipidemia. There's many things that can be done at city level, and also advocating at the city level, because if your mayor is a champion of cardiovascular health, it's going to help at the country level. Your community, could be your school, could be your university, your company. We believe that companies and the private sector can do a lot, not only to help or promote cardiovascular health for the employees, but also in terms of advocating, in terms of good practice, in terms of insurance schemes. There are interesting models, companies providing some health insurance for the employees, and that's something we should definitely encourage and support. And I put at the end your family. It's not so much to tell your children to eat fruits or things like this, but it's in terms of advocacy, we know that the cardiovascular community is not as strong as other communities. And if I take heart failure, for instance, it's true that the aging population, elderly people who have difficulties to move, to speak, to breathe, will not be advocates. They don't be a strong voice. But their family, their children, their spouse, their partners can be strong advocates. So keep this in mind, and let's use art for action. So to conclude, just to come back to this QR code, you can scan it to sign the petition. Our main objective is to motivate every country to have a national action plan for CVD, sign the petition. We'd like to have 1 million signatures by 2025. 1 million can seem a lot, or maybe it's not a lot. If you just think that 20 million people die every year from cardiovascular disease, 1 million of their family, of their neighbors, of their parents is not a lot. Thank you very much. Enjoy the meeting.